Hello and welcome to this presentation. In this work, I'm going to present two projects that we did for two different clients. So we have many clients. They approached us and we usually present them with multiple proposals. And among all of them, these two chose to go ahead with scientometric mapping rather than any sort of evidence synthesis such as evidence map, scoping reviews, systematic reviews, meta-analysis. So they preferred to go ahead with scientometric mapping for their future needs. And they asked us to scan the horizon for them to see what is around, what information is available, what are the gaps based on the brief information that we could get from the databases without looking at any full text reports. So the first organization was a charity, a UK-based charity, CCUK, Crohn's and Colitis UK, who are working on mainly inflammatory bowel diseases or IBD. And they approached us to ask for a research to help them build a research collaborative on fatigue. So you may ask that it's IBD, Crohn, Colitis, what has to do with fatigue? Fatigue is a cross-condition consequence of disease. So it is not just for the IBD. It could happen in cancer, it could happen in neurological disorders, cardiovascular disorders. So it is a cross-condition outcome. And they wanted to know who is working in this field, what are they working on, what are the research done, the research methods, what are the institutes that are working on the topic, what are the existing gaps, if they want to fund a systematic review in the future, or any research indeed, what it should be. And they wanted us to provide information for decision making. But they didn't want to go deep into the literature, like reading the full text, because as soon as we step into that stage, the project becomes expensive. So we did the work using scientometric approach, which is much cheaper. It can be done. The basic findings could be presented in a day. The report could be prepared in 1 week. So it is pretty rapid. The second organization was American Association for Cancer Research. Because the report that we sent to them is not publicly available, I'm not able to present all of the findings, or any findings indeed. But what I could share with you is that they have a great genomic data set, and they wanted to know who is using and citing their data set. And we had two different projects, two different clients with two different objectives, and both of them thought that scientometric approach would be helpful for them. The methods that we used is Scientometrics. It is old dog, so it is not new. Scientometrics is older than a century. And we use social network analysis, which is again not specific for scientometrics or bibliometrics, but it's been used in sociology, it's in epidemiology to find the case zero, to find how the infection spreads. But we used co-authorship networks that relies on the theories from social network analysis to help us know why people are working together and why not working together. So what are the gaps, if there are any new links to be established among the people? And it looks like a perfect match for the need of the organization Crohn and Colitis UK, because they exactly want to build a collaboration. We used content analysis based on the medical subject headings. And we also use some components of systematic reviewing, including having the inclusion-exclusion criteria and doing some screening. And then we had gap analysis as well. So we wanted to know what systematic reviews are missing, and if they decide to fund a systematic review, what it can be. But we also looked at what primary research might be missing. The sources that we used were MEDLINE, Science Citation Index-Expanded, PubMed and Scopus. And the only data we had were the bibliographic data that exported from these databases. We use the visualization that exists in some of these databases, including Web of Science and the Scopus. They provide, so their interface provides some facilities for the visualization. We also exported full records from Science Citation Index-Expanded for VOSViewer, for creating co-authorship networks. But before doing that, we did some validation check in Notepad++. If there were any errors, we corrected them. With errors, the visualization cannot happen. We also exported results from EndNote based on each healthcare condition, and also in different file formats, creating the output filters that is possible to do in EndNote. And then we also exported some data from EndNote to Excel to do the subtotal analysis, data deduplication, and data visualization. So what are the exciting findings that we got? So because we did targeted search, we knew that majority of almost all of the papers should be relevant to fatigue, to inflammatory bowel disease that encompasses colitis and Crohn. So we already knew that. You can see that they are in the left figure. You can see that they are the most frequent topics. And this figure shows the PICO information, mainly problems, interventions, and outcomes. So if we look at the ones with the highest frequency, quality of life seems to be extremely important for the researchers, at least. And then after that, it comes to the severity of illness index, and then it is followed by depression and anxiety as psychological outcomes. So we expected at this stage to have the physiological outcomes more often, but it shows that actually physiological outcomes come later. So either the researchers or the patients have declared that psychological outcomes are important, or maybe the physiological outcomes have been reflected on quality of life and severity of illness index. But anyway, we also know that there are at least 16 papers in the middle of graph that are specifically reporting on patient-reported outcome measures. So it might be important. Among the interventions, we see the exercise and infliximab as the ones that have been used with the highest frequency in the research. And then we have a few biomarkers as well. In the right-hand side, however, we have the research methods and research techniques used in the all of the papers done on IBD fatigue. And you can see that surveys and questionnaires have the highest frequency. It could be an indicator of many studies being observational, but if we are not sure, we could look at the rest of the high frequent methods, and you can see cross-sectional, perspective, prevalence, case control, cohort. So it actually shows that yes, majority of the research done on IBD fatigue are observational, and then it is followed by randomized controlled trials that are only 10 reports. At the bottom, we also did some validation check based on the age group, because we needed to know if the research, published research, reflects the prevalence of disease across age groups, and it did. So the publication actually is the representative of the age groups, the prevalence of the condition in the age groups. Here what you can see is called co-authorship networks, and based on the top figure A, you can see that King's College London collaborated with Crohn and Colitis UK, a charity, and with University College London. Possibly because of geographical proximity, they've worked in a triangle, and they've done the major research, and they are the leaders. So King's College is the leader of the research in IBD fatigue globally, but they are working closely with Oslo in Norway. They also have some collaboration with France and Belgium, but little collaboration or no collaboration with Netherlands, Erasmus. Let me just show you here. So this is Netherlands, we have United States here, and on the other side we have Heidelberg University, and we have Calgary working. So what does it tell us? It's a nerve cell-shaped figure showing that people in different corners of the world are working on similar topic. But it raises the question, for example, why King's College is not working with Erasmus or Pittsburgh. So there is a gap, there is a collaboration gap, and it is important for our client because they wanted to build a collaborative and they want to connect these people. The more interconnected these networks become, the more stable and sustainable the network of research is. It means that the research is going to continue and it's going to be impactful in terms of dissemination, in terms of global impact. In the middle, you can see the collaboration across the countries. Obviously, it is reflective of what you saw in the A section of the figure. It shows that England has got the greatest collaboration to IPD, the greatest contribution to the IPD fatigue research in collaboration with Norway, but also Netherlands and USA have done good job. So these four are sort of doing lots of research, but there are only a few countries, other countries in the network. So this is not sort of a research that interests all countries, all 195 countries in the world. And there are only people in Europe mainly working on it, in the United States, in Canada, and in Australia. So there are a few other countries from here and there. At the bottom, you can see that there are clusters of individuals. So if we looked at institutes on top, countries in the middle, we have individuals at the bottom working on IBD fatigue. So the blue ones are King's College. They've got the largest circles showing that actually they've done most of the research. They are collaborating with Norway in red. But also you can see that there are people here, bottlenecks, connecting these two networks to each other. These are important people because if they disappear, whatever happens to them, the networks become weaker. That's why it is important to have more interconnected network. You can also see a green cluster here and also a yellow cluster, that each one of them could reflect individuals in different countries who are not actually working with each other. So it is a gap there to be filled. This is just a brief map of who did the research on IBD fatigue. As you can see, so UK is leading, and then there is United States, there's Denmark, and also Norway. After that, it's gonna be Australia. But there are other countries that are trying to join the network, so they want to do some work. We have Canada, Mexico, Brazil, we have China, Iran, Romania, Italy, Spain. So we have other countries interested, but we couldn't say that there is a global interest in the topic. But it also shows that actually it is possible to build an international collaboration if there are people in at least 4 continents who are interested in the topic. Who funded this research? Briefly, we were surprised to see that actually the main funder of IPD fatigue research is Crohn and Colitis UK. Our client was surprised as well, because they thought that actually there should be more funding coming from the government, from the national research bodies, but we saw that it is actually a charity, a community-based charity that have done most of the work, which is heartwarming to see, but also it is disappointing that why not the national organizations, the government hasn't done much work on this. And then it comes AbbVie as the second funder of the IBD fatigue research. We have Canadian Institute of Health Research that has funded all 5 published research. So there are only 5 from Canada, all 5 of them funded by Canadian Institute of Health Research. And then we have 5 pharmaceutical company again. So this is not what we expected. But anyway, it's a good finding. We know the funders, we could put them together, we could contact them, ask them to put money aside and build an international collaboration to tackle this problem. So, what did we learn? I already presented a few of the outcomes and a few of the important interventions. We also have CRP and TNF alpha as the main biomarkers of interest among the researchers. We realized that majority of the primary research, a majority of the topics with a lot of primary research have already been systematically reviewed. There are only 2 areas that have not been systematically reviewed, and it is possible that we see systematic reviews on these topics in the future: patient-reported outcome measures and some of the biomarkers, including CRP. So these are the ones that probably are going to be systematically reviewed in the future. We also noticed there are a lot of observational studies, and it shows there is a gap for the interventional studies. We don't have enough interventional studies in the field. Lots of observational studies is an indicator of low funding in the field, because it is much cheaper to do the observational studies generally than interventional studies. There were also, to our surprise, there were limited qualitative studies. Fatigue is considered to be a subjective phenomenon. So when something is subjective and you want to understand it, it requires qualitative study. And we had limited numbers, so we reported back to our client that actually qualitative studies alongside randomized control trials are missing from the evidence. So if you are going to fund, this will be something to consider. And some of the institutes are not connected to the network, so you need to contact them and put together a network of people, a collaboration, so we could tackle this cross-condition, multidisciplinary problem called fatigue. And then there was a funding bias in high-income countries. The majority of the work was funded by charity or pharma, limited funding from national medical funding bodies and government. And we recommended that if the client goes ahead with funding international collaboration, let's say for fatigue, what they need to do, this collaboration should focus on developing the standards of best practice, including clinical practice guidelines for fatigue, because it doesn't exist right now, or it is very dispersed. They also need to standardize patient-reported outcome measures, or put together core outcome measures for fatigue, and then define the fatigue, because there is no consensus right now. It will be very important to define it, define what fatigue is and how to measure it, and when we face it, how to deal with it. So this is what this collaboration, international collaboration, can do. So we provided the information that client asked, and it is up to them how they are going to use it. They said that we will use it alongside other information, but it shows that there are organizations using Scientometrics, a very old dog, for knowing what to do in the future. The first version of this report is published. It's open and it's publicly available in F1000 Research. The second version needs one peer reviewer. If you are interested in peer reviewing this work, please do contact me. I thank you for your attention and time, and I apologize that I'm not there personally to take questions. If you have any questions, email me, and a copy of this presentation will be available on our YouTube channel. Thank you.